And now we are recording, so we're not allowed to swear anymore.
No, sad
Looking at you,
times.
Steve.
I'll
So,
try. I can make no promises.
welcome to everybody on all of the platforms and all of the internets all of the world. This is basically a chat that young Steve set up because we did a few chats about podiatry stuff for the running club. And Dan is an osteopath and watched one of those with interest and said he would also be interested in having a chat about musculoskeletal stuff for the running club. So we've gotten together with really the intention of chewing the fat, in particular about barefoot running and foot strength and its relation to injury and running shoes and that sort of thing, which is something I know we're all interested in. So, just to go around the room, for those who don't know, my name's Robert. I'm a podiatrist. I have a special interest in biomechanics, pediatrics, and chronic pain syndromes, but am forced to treat runners because they keep limping into my clinic with sore feet, and I can't refer all of them up the road. Steve, tell us about yourself.
Well, hello, everyone. I'm Steve Grantham. I'm the founder of Beginners to Runners and also the managing director for Beginners to Runners Health Coaching Limited, which is a bit of a mouthful. We need to think of a better name for that. Yeah, so I'm a running coach. I have 22 running clubs around the county, 7 doctors' surgeries, and I specialise in taking people who are very, very unfit, giving them uh, the will to get fit, and then taking them along for the ride and showing them how to do it. Been doing that for 12 years, and I break lots of runners very regularly and recommend they come to you or go to Dan. Yeah, so we've been paying for your kids to go through school for a long time.
Brilliant. Yeah, this is all just a diabolical scheme. You break them and we fix them, and then we give you backhanders, but we shouldn't tell the public
Exactly. Yeah,
about
that's it. Oh, that's it.
it. Let the cat out of the bag now. And Dan,
Yeah.
tell us about your background.
Yes, my name is Dan Fernandez, osteopath in Maidstone. I've got 2 clinics at the moment, and I've been working together with Steve for the last 10 years, basically. So,
Decade.
yeah, I've met Steve back in the day when he only had 2 or 3 clubs, and he was breaking his patients, his clients, and
Yeah.
and they were coming to me because of recommendation, and I started saying to Steve that he needs to make a better warm up and ask the clients to do their foam rolling stretching properly. And since then, everything changed. Now Steve's got 20 something groups and everything's gone proportionally big. So yeah, I'm here to help in any way I can to provide whatever solutions people need.
And I think you've got a special interest in running shoes as well, haven't you, in particular? You
Ah,
are a
man.
runner yourself.
Yeah, I've been running for a couple of years, all sorts of running. And
He's underselling himself. He's an excellent, excellent athlete for a runner.
thank you.
Yeah.
Um, I like running. I also like mountain biking. I love it because it doesn't put so much impact through your body, and you get to address the adrenaline. And like yourself, Rob, I was mentioning I've also done martial arts in the past, and um, I'm really keen on it. But running and barefoot, I run with a zero drop shoe. I've been running with 5 finger shoes for I don't know 13 years now. 13
Long time.
years I've been using, but I don't ever promote it for people because people don't typically want to do the work that you need to run with a zero drop or a barefoot shoe. And we can go into more detail if you want about that because there's 2 different things.
Definitely talk about that. That's a good thing. Okie dokie then. So what I figured I'd do is just by way of throat clearing, I'll do a little bit about sort of the history of barefoot running as I see it. I'm not a runner. I do not enjoy to run. I get my kicks other ways. Um, so we'll do a little bit about that, and then I'd love to know.
That's actually really valuable, I think, because having an outsider's view, because Dan and I will think very similarly, because Dan taught me a lot of what I know. So actually having someone from the outside who doesn't have a runner's perspective, I think you're going to add some unique insights, which is going to be
uh,
to
it's
see.
good to have different perspective, certainly. And I am, as Steve has long bemoaned, I am very much a pedant from a scientific point of view. If I'm going to say a thing is true, I need to have some science to back it up. I need to have a reference for everything. So I try very hard to maintain that, and that's a useful thing. I think sometimes we all need that friend, as
Yeah,
annoying as
I
they can
rely on
be.
wild guesses. So
No, the term for that is a swag, which is
oh, how different we are.
a swag is a scientific wild ass guess.
Oh well, that's it. I'm full of
If you ever
swagger.
see citation swag,
Yeah.
that's what that means.
Oh, okay. Well, yeah,
So
that's me.
the main, I mean, barefoot running has been around obviously forever. Zola Budd very famously did a race at an Olympics and did quite well, although not as well
Mm.
as others have done since. And running spikes used to be flat and floppy, but the real sort of fashion of it came up about sort of 15 years ago. And
Mm.
there were two pieces of work. It was Kerrigan and Lieberman, and they did Lieberman did studies on impact transients through the knee. Kerrigan did studies on joint torques. And what they found is that the joint torques were less with barefoot running, and that the impact transients through the knee were less with barefoot running.
Can you
Um,
explain what talks means, please, Rob?
Torques just means the amount of bend, the amount of flex, basically the forces going through the joint.
The tension. Yeah.
Yeah.
Mhm. Thank you.
And that should have disappeared into the general maelstrom of scientific data that we have, because those findings in isolation were uninteresting as far as they went. But then they got picked up on by the media in particular, and that got translated from impact transients in the knee were less to less knee trauma to less knee injuries to it's better for you. And a chap called Chris McDougall wrote a book called Born to Run,
Yes, good book.
which, oh
Good book. Good book.
God,
Good
it's
book.
not a good book. It's a
It is a
terrible
good
book.
book.
I knew
That,
you. I told you he's pedantic.
yeah, that to my mind, that book is to running science what King Herod was to the Bethlehem Playgroup Association. It
Oh,
is just, it was bad to my mind, but you may
that book
disagree.
is like the one of the top 10 books to read when
Oh,
you start running.
it's my problem with
And
it is that
Running with the Kenyans is my favourite though.
That's good.
it takes what is a very complicated issue and a very complicated question, and it crystallizes it down into natural running is good. We were born to run barefoot, therefore we should run barefoot to avoid
Mm.
injuries. And that is, I can't say what that is because we might have kids watching. I do
Yeah,
not agree with that contention.
but
Um,
like everything, Rob, everything is with a pinch of salt, right? Let's say broccoli. Broccoli's really, or spinach are really good for you, but you can't eat it all day, every day, and the only thing that you have, right?
mm,
So I think that most people, when they read that book, they said, "This is the next best thing. This is what we have to do. Let's chuck our shoes." And they were already doing 5Ks or 10Ks or long distances. And what they've done was going straight into barefoot
yeah.
without any proper training on stability, and they went from a heel strike to a heel strike to do midfoot strike, forefoot, and it's just crazy. And I saw most of that research where people are saying the barefoot running is rubbish. I've got so many injuries. Is like, yes, because you were a ding dong, because you
Mhm.
didn't take the necessary instructions in getting stronger. Like
Mm.
I was one of the UK promoters for Five Finger Shoes a couple years back, and when I was promoting them, I used to say to people, if you want to go barefoot, before you even think about running, you only can walk with them because
Mhm.
there's going to be a biodynamic change on the joints that need to have time to adapt because fascia takes time to adapt. But people didn't. And then I think that's the main reason for all those injuries.
We both of us,
Interesting.
I suspect, had a very busy few years in clinic after that book came out.
Yeah, I have to
Yeah.
Um,
admit, I bought those shoes And I thought, it says you're born to run, so I'm just going to run. And I ran up the road and thought, I'm never running in them again because my feet were mashed to pieces. So
Yeah,
yeah, they really, you do have to get used to them. But I guess it's a bit like walking boots, isn't it? Like when you buy a new pair of, or get a pair
100%.
of boots, you've got to break them in really slowly and you wear them around the house. And even a new pair of trainers, one of the advice I give to beginners, because they always come with a ropey old pair they've had for 10 years, and they'll have a little go in them and it's okay for the first few weeks. The analogy I always use is if you'd had a nice go a game of crazy golf, you wouldn't run straight out and buy a brand new set of golf clubs with carbon fiber handles and things. So I say make do with what you've got for a few weeks, and then when you're ready to get running shoes, get the right running shoes, get fitted for them. And we talked about that before. And then when you get them, there is a settling in period. I say wear them around the house for a day or two. Get your feet used to them. Then your first run's a little bit slower and shorter than that. And I think you taught me that, Dan, didn't you? Saying that because because it's corrected your feet or the way you run style, not corrected, but forced you into a style, and then your own style sort of molds the shoe to correct it as they wear in. Is that right? Or am I going off piste there?
I mean, there's a huge discussion. Like I just pushed up my five finger shoes that I have here in the clinic because I like to work with them. It just makes
Mm.
me feel more comfortable. Um,
Dan, that
but
sounds almost like a fetish.
Push
Should
them
feel
up is an
comfortable.
unfortunate choice of words, certainly.
yes,
Yeah.
but going back to what you've mentioned, I think that most people want to correct their running or injuries by putting a shoe on that is highly supportive without them actually need it, because there could be problems with other structures. Like a lot of the most common thing in my eyes as runners is people been told I overpronate. And when you get that word overpronation, everybody knows that you should have a supported shoe. But
Mm.
what they don't tell you is that most of that overpronation doesn't come from the foot, it comes from the hip, because it's the external rotation of the hip that rotates it. There's a whole lot about it. And coming to the shoes is it's that facilitation that you need to, like you said, Steve, to leave the shoe to time to adapt. Like everybody knows, you shouldn't put a new trainer before you go a marathon.
Yeah.
Oh, I wasted my shoes doing my training, and after I had a new one just from a marathon. It's
Yeah.
just that's
How
a
many
bad
times have
idea.
you heard that? How many times have I
Loads,
heard that? I'm
loads,
going to buy
loads,
a new
loads.
pair of shoes for the race. Oh, I've got a lovely pair of new shorts for the race. And you're like, you've never run in those shorts before, and you're going to risk it on the 26 miles of chafing is something you will regret. So always wear tried and tested kit on race day. But Rob, going back to Rob quickly, we was discussing this last week, and you have a bugbear about the pronation being getting a stability shoe is the panacea to all problems. But
Huge problem with that.
mm,
I think, first of all, that my students know this one. The word overpronation brings me out in hives. It
mm.
literally, I get stabbing pains in the muscles and fever, and it's. I've yet to find somebody that can define overpronation in a way that is not tautological.
Yeah.
What is pronation? We all know what pronation is. It's dorsiflexion, abduction, and eversion. That's easy. What's
In English.
overpronation? Sorry, foot goes that way, that way, that way.
Thank you.
Sorry, that way, and that way.
Mhm.
Um, but at what point does it become over pronation? Because it's not by the number of degrees. If you measure it, foot posture index,
Mm.
FBI 6, um, you've got people who pronate massively and run brilliantly. So we can't say they overpronate, they pronate the right amount for them.
Yeah, I
And
was
you
going to
might
say
have
overpronate. Overpronate implies that there's a good
too much
amount
of
of
it.
pronation,
Yes.
and then you cross a line into
Yeah.
too much.
So
But
you
where's
can't
that line?
we can't draw a line and say this number of degrees makes it overpronation. That
Mm.
definition doesn't work. So we could say, well, it's the amount of pronation where it causes a problem. If it causes a problem, then it's overpronation. If it's not
Yeah.
causing a problem, it's not overpronation. But the problem there is we've then got to define, did the pronation cause the problem? because by that
Yeah.
definition, anyone with a problem with any pronation, we could say, well, that's overpronation because they've got a problem.
And
And they
most people
create.
have pronation of
If,
some
if
sort.
they haven't got pronation, then they're in all kinds of trouble.
Yeah.
So that definition doesn't work. So
Yeah.
Dan, do you agree with that? Is that?
So everything that Rob said, I agree with because it is true. Now,
Mm.
when the foot needs to pronate, if what I don't like for some of the professions, I don't know if Rob does this, but um, is when people just say, "Oh, you've got overpronation, you've got a problem. I'm going to stick you with a hard insole," and I'm like, the foot needs to biomechanically move. Once you put your foot down on the floor, your foot needs to spread. It needs that because that windlass, as soon as you step up, your toes go up, and that activates. It's called a windlass mechanism that activates your Achilles, and basically it's a absorption with a stretch that allows your foot to move forwards and propel that energy that you absorb. If you are not having that, if your foot is stuck, then
Mhm.
how are you going to extend? You're limiting your
To get the spring,
possibility
yeah.
to get the spring.
100%.
Yeah.
Mhm.
So
100%. And
it's
not only that, I mean, you need it for the energy return, but you also need it for the adaptation because the ground is not flat.
No,
yes,
So in
yeah,
real life, if you didn't have pronation and supination, as soon as you step on a curb which is 5 degrees that way, all of a sudden your whole body is at 5 degrees that way.
yeah,
And
of
I'm not an
course, yeah,
expert in hips, but I'm going to go ahead and guess your hips ain't going to like that.
yeah. No,
Um,
exactly.
yeah, and
well,
we know that
that's
too.
the first thing that happens, and then you'll get rolled ankles and things. So that's
Yeah,
to pretend it's obviously to give you that sort of leveling play, isn't it?
Yeah, Rob, I worked for a sweatshop for 2 years. Okay, I was working at sweatshop as here in Maidstone for
I
two
remember.
years, and that's how I met Steve. And the thing was this is that we were working there and we had to sell insoles. And I say, if you're going to sell insoles, but at least the ones that we sold at the sweatshop, at least they were moldable. They give
Mm.
you a bit of support, but they were moldable. But I always said to people, if you want to get strong, if you damage your knee or your hip and you're having to use crutches because you see the crutches as a limitation, you do whatever exercises you need to get off of the crutches. Now, why do you think that's going to be any different with your foot? You need to create stability and strength into your feet so that you don't need support, the arches. You just get stronger.
Mhm.
So that's my belief.
So how do you get stronger arches?
Well, by being
Mhm.
barefoot, walking barefoot in your house, not going outside, just being barefoot in your house all the time. Most people still like to use their shoes indoors. I'd
Mm.
recommend just be barefoot inside. Then you can do exercises. You can do like calf raises. Let's give you an example. If I got a patient in here that just twisted their ankle and their ankle got swollen, I remove the swellingness with treatment. I increase the fluid circulation throughout the body so there's less inflammation, but inflammation will come back because it's process of the healing. Like I heard Rob talk about that in a previous video, which is exactly that. We need inflammation, but
Mm.
if it's too much inflammation, then it creates that stagnation. But
Can I pause you there 1 second? Because last night this was exactly poignant. We was doing our heel training and we'd warmed up and done everything, and the chap went, "Oh, my groin! I think I've pulled something in my groins." And I said to him, so the advice I gave him was, "Don't go straight for that. You know, a little bit of ice on it, but don't go straight for that. Don't worry if it goes a little bit red because that is part of the healing process." And then
mm,
just do that. So is that the right advice for that kind of injury as well when we're talking about that or not?
well, if it's in
can't
the growing,
generalize.
yeah, you can't generalize because everything, especially if it's in the growing,
Mm,
how old was he?
about 60.
So now you're thinking, okay, it's in your growing. There could be two things. Was it because you were running, you overdid it on the sprint and you strained it, or
Yeah.
could it be an inguinal hernia? We
Oh,
don't
really?
know.
Probably a strain the way it happened, but obviously I can't say categorically. I think it was an
Exactly.
overuse I think it was an overuse exertion because it's the first time they've run fast ever, probably.
Oh, it was at the sprints things that you were
Yeah,
doing.
yeah, just doing those silly things.
So my example to do that before getting paid people to do those sprints, I would
Mm.
tell them to do skipping. The skipping motion increases their heart rate, and they
Mm.
bring in the knee up. They're hitting the floor a lot easier,
Yep.
and they're propelling forwards. So
I was
then,
just about to do a video today, hopefully, but to release next week of A skips, B skips, and C skips. So I'm glad I'm on the right path.
yeah,
Sorry.
you don't worry, you want to do the less invasive than to the more invasive. If you want to become faster, you know that with running, you need to be doing sprint hills. But
Mm.
before you do sprint hills and try to become faster, you need to be able to do a 5K. You're
Yes,
not
of
going to
course.
go, I'm going to start running sprints. No, first we need to create what is our
Yeah,
average of a 5K and then work towards that. But we have to do the endurance, we have to do the training. So everything
exactly.
has its own
No,
pace.
that's exactly right. Right, that's exactly right. Because what we did a 1K, 1.5K run before we did already done a warm up. Then we did 1K run. Then we started with a walking version of it. Then we built up to a 50% power. Then we said, right, let's have a go at the 90%. And then once we'd
Ah,
done it on an incline, which made it hard, makes it easier in the sense that you can't go as fast because it's uphill. And then
it's
when
more
you go onto
stress. It's more stress.
more stress, but less speed. So on the flat, suddenly they're flying along and they experience the speed. It's one of those,
Yeah.
you never
So,
like anything I do because it breaks people.
Something I
so
would just sort of
Yeah, go Rob.
like to
Sorry.
expand on that a little bit. The
Mm.
the, the whole business of the conventional wisdom, the what we get if we ask ChatGPT, is that if you are wearing supportive shoes or orthoses, that involves less muscle activation and therefore weakens muscles.
yes,
And if you are barefoot, that involves more muscle activation and therefore strengthens the muscles. And most of this, we're looking at the intrinsic, the big three intrinsic foot muscles.
Mhm.
That is not what the research consistently shows us.
Oh,
mm,
interesting. Tell
Um,
us.
there's a few different things, and there's a lot of research over this, and it doesn't all agree. It doesn't all say the same thing. Um, I think it was Michaud did one where he looked at people who were normally shod, people who were normally running in shoes, and he got them running barefoot. And he did fine wire EMG, which is for Steve, fine wire EMG is where you get a wire which is about
Hmm.
as thick as a hair, and you stick it into someone's muscle.
Oh, really? Like,
And then you can get them to do stuff, and
mm.
then you can observe the muscle firing. You can see what it does. And what
Oh, okay.
they found was that the shod runners
Mm.
had less movement. The foot moved less, as you would expect, because the foot was supported, but
Yeah,
more muscle activation.
interesting.
The
Why would that be
barefoot
then?
runners had more movement, but less muscle activation. We also have the fact that
where was that made? Muscle activation of what muscle?
it was the intrinsics. So it was abductor hallucis, flexor digitorum brevis, and quadratus plantar.
Okay.
Um, we also know that there have been some studies that showed that wearing orthoses didn't affect muscle size. But we don't know for certain if muscle size correlates to muscle strength in your foot. And we know that people who are more pronated have a higher foot posture index, have larger intrinsic foot muscles. So I'm not saying that there is not an impact on the intrinsic foot muscles when you transition between barefoot and different types of shoe. What I am saying is that we cannot reliably say orthoses support the foot and weaken the arm and weaken the muscles. We cannot reliably say that strong muscles equates to a less pronated floppy foot, and weak muscles make a floppy pronated foot, and strong muscles make a better supported foot. That's not the case. Um, and the relationship between what we do, how the muscles activate, and how the muscles present is not clear.
Hmm.
Hmm.
Would you think that that will also be related with the amount of the activity of each person?
Yes, and all of these studies are
I was
going
just
to
going to say,
be,
every person, it comes
yeah.
down to, again, it's horses for
Well,
courses, is it?
it is, but when you take a study like that, you've got to look at the client group. So, for
Hmm.
example, there was another one last year. You'd know this one, Dan, the one where they actually used barefoot running as a prescription for plantar heel pain. It wasn't ready. I'm gonna have to Google it. But what they did is they basically took people with heel pain and they said, right, get you running up and down barefoot and see if it helps with your heel pain. And they found that
Hmm.
the group that they got running barefoot, their heel pain got better.
Can I,
Um,
can I, I,
but
I can interject on that. I've got a real world example whenever
can,
you're
can,
ready,
can,
Rob.
can,
So
can I
come back
finish?
to me.
Can I finish your my point?
Of course.
But they didn't have a control group.
Hmm.
So what they did is they took a whole bunch of people who, by and large, the average BMI was 29, so people who were metabolic underachievers, and people who were mostly sedentary, and half of them they just gave, I think it was ultrasound, and half of them they got doing this barefoot running, and the group that they did barefoot running improved, but we don't know if that was just because they were doing because we know
Yeah.
Activity.
motion is lotion and rest is rust. So
Mm.
Exactly.
there's definitely something there. There's definitely an interaction, but I do think we need to be very, very careful being confident about this shod and supportive equals atrophy equals less muscle activation equals less stability.
Yeah.
Mm.
Unshod equals more equals better.
So
I,
in a plain English,
Sorry.
just summary for
Yeah.
that, because no, I was following very, very well, but just
Yeah.
in case anyone is lost, what you're saying is that the assumption generally is that if you don't wear shoes, that's a better thing and the more holistic and the
Yes.
best, you're more in touch with your roots and stuff.
The
And if you're
born to
wearing
run thing.
shoes, if you're wearing shoes, you're almost cheating a bit and
Yeah.
making it easier and your muscles won't get anything. That isn't what the science and data shows. What the science and data shows is that both have effect, both do
Yes.
things. Um, slightly better with the shoes, you're saying, is that right?
No, I wouldn't say
Or it's
that either.
margin. So there's not an awful lot in it. It's more about running with good technique is what more important. Is that
What
what you're
what I would
saying?
say is what Dan was saying earlier, that n equals one. Every person is an individual.
Hmm.
So we have to be incredibly careful about making any kind of sweeping statements about what X will do.
yeah.
Okay.
Because, and I know this naps you off, Steve, when I do this in other areas, it's always more nuanced and complicated.
Of course.
Um,
Yes.
just
Yeah.
again, and I know this isn't a research roundup, but because I just love this guy's work. Are you familiar with Luke Kelly, Australian guy, done a lot of work on intrinsic muscle power.
I know
What it,
Ned Kelly, wasn't he an outlaw?
different guy. Very
Is his
briefly,
uncle?
what he did is he did fine wire electromyography on these foot muscles, the ones that we're always trying to strengthen, and he basically puts a foot on the floor, puts load onto it, and then says what happens to the intrinsic muscles. And what he finds is that when you stand up, they're basically switched off. And then the more weight you put on them, they exponentially switch on more. So he says, brilliant, they have a role in stabilizing the foot. And then being a good scientist, he then said, well, what if we activate them? So he put the foot on the ground, he loads it, and then he sticks another wire in there and he actually switches them on. He uses electricity, basically an internal TENS machine, and makes
Mm.
these muscles activate. And sure enough, the arch comes up. So you think,
Oh.
great, we know the intrinsic muscles, they activate to resist the arch bottoming out. And when you activate
Mm.
them, they bring the arch up. So then he did, being a good scientist, did another study and he said, well, what if we switch them off?
Mm.
So he did nerve blocks. So they knocked out these muscles in a sample group and he got
Mm.
them to walk and run and he found it made bugger all difference.
Really?
Switching them off did not mean the arches flattened out more. What it did
I was still
mean
none the
is that
wiser.
it didn't propel as well. So the energy return, the bit with the tendon, where
Yeah.
the muscle is necessary to tighten up for the tendon to function as a spring, we were fairly confident about that. But the point of that is you can have these little nuggets of data. If I told you, these muscles fire to resist the arch deforming, and when they are fired, it brings the arch up, you would assume that's their job. But
Mm.
then you do a study that says, well, if we take them out of the equation altogether, it doesn't make any difference to the arch.
Well, the difference
Um,
here is that, Rob, if I could say something, is that
please.
we we're always trying to differentiate between muscles, tendons, and ligaments and joints to try
Fascia.
and individually see what makes what tick.
Mm.
But in the end of the day, the biggest the biggest conclusion is that it works all together. Everything is fascia, everything works connected tissue. So even though when something is turned off, like let's say you've got your artery, and for whatever reason that is blocked, then there are other areas of the in the arm that have other arteries that will supply to exactly the same spot.
Mm.
So it, everything is integration. Everything the body knows as a memory. Memory is in the water, memory is in the fascia. Everything is connected. So in something like that, I know that in the scientifically world, they want to break it down to know exactly, but I think it's beyond that, to
I
be
agree.
fair.
And I think that there's the two things there is very much like the difference between religion, or the thing with religion as well. Um, we can say it is mysterious ways. N equals one. There is fascia, there is muscle, there is tendons. Everybody is different. Their skeletons are different. Their capsular patterns are different. Their activities are different. So therefore, we're really not sure, and that I'm
Yeah.
perfectly happy with. But we cannot then say, oh, but by the way, if you do a short foot exercise and pick up a pencil 5 times a day for 6 weeks, your arch pain's going to get better.
Mm.
We've either got to accept that we operate in this atmosphere of uncertainty, or or we've got to justify how we don't. But we
Yeah.
can't
Mm.
have it both ways. We can't say barefoot running is better. Walking barefoot strengthens your foot muscles and therefore reduces your rate of injury, because those are definitive statements. If we're going to be open-minded and allow all this uncertainty, we can do that, but we have to be consistent then with that. And that's my
Yeah.
problem with barefoot running, because they're
Well,
not. It's dogmatic for so many people. It's just like, no, this is right. This is what you
okay.
should do.
Let
So,
me
so,
just
so let's try something interesting. So we've got Rob, who's slightly less for barefoot running, and you are slightly more for barefoot running. Why doesn't Rob make the argument as a steel man for why barefoot running is a good thing to incorporate into your training?
I
And
love that, but
Dan, can you do a steel? Can you do the same as steel man for why barefoot running it's better to use a trainer? And I thought
okay,
maybe argue the opposite for
I,
a bit
I
of
will.
interest.
But Dan, you were about to say something there, and I
Oh,
really want to
Dan,
hear what
sorry.
it is. So
Yeah, of
say your point, and then we'll do that because that
course.
sounds
okay.
fun.
So before exactly it says with an osteopathy, we try to do and treat the body as a whole, and we are ground based on a foundation of the five models. So it's not just the biomechanical. We've got the neurological with the nerves. We got the respiratory and circulatory. So when you breathe in circulation, you've got the metabolic, which is all your hormonals, and then you have the biopsychosocial. So it's everything is related. So within your stress, if you stress, you won't sleep. If you're not sleeping, you're not resting. If you're not resting, you're not getting enough energy for the next day. So when it
Mm,
comes to injuries, all these things, and I'm stressed, and now my posture is going to go down. I'm stressed. Everything relates to that flight and flight or rest and digest. So when one has an injury, we have to take the whole cake in consideration, not
mm,
just foot problems. Because the way of you being, when you like a good song and you go out for a run and you have all these good vibes, that will affect positively into you. But
mm,
if you're now thinking of, I've got a shitty job that I have to go every day, then
mm,
your runs are not going to be so effective. But they will
100%.
still be a way of you to release that stress.
mm.
But I mean, you've come to my clinic, Steve, you know how it is. In here, we've got the quotes all in the ceiling and
Yeah, it's
everything.
relaxing.
It's about trying to increase everything so we can work with the healing for everything.
Yeah,
Love that.
it's great. It's like
Absolutely
you know,
love
I
that.
think of it like an orchestra. I think
Yeah,
your health is an orchestra. When everything's playing in tune, it's the most beautiful songs and capable of moving everything. And your life's good when you hear good music. And then suddenly you might have a violin that's out of tune. It's over the top. It stands out a mile, and suddenly the song doesn't sound good. And then you get another one, a guitar, is blah, dong, dong, and it's out of tune, and that's because you haven't done something else. And if you don't start addressing the people in the orchestra are playing out of tune and do something about it, first of all, there might be other things going on, like the guy who beats the drum might be out of time. But you're not focusing on that because all you can hear is the violin that sounds like soaring metal. And I find that you with your health, you want to try and at all times be able to play the most beautiful song you can. And if things in your life aren't right, then you need to start addressing those little bits and bobs. So that, yeah, have a healthy orchestra.
Yes, that's a great point to put it.
Yeah. Rob, are you ready then?
Yeah. Okay. So steel manning, barefoot running, and barefoot function generally.
Hmm.
I would say things that we know scientifically. We know that when you transition from one form of running to another, from shod to barefoot or barefoot to shod, you are going to change pretty much everything.
Hmm.
We know that if you have a problem with the way that you are running now, that leaving everything the same is going to cause a problem.
Hmm.
Therefore, it is not unreasonable to say, well, this will adjust all of the dials. If you think of the, stride length dial and the foot position dial and all the rest of it, we can try tweaking the little ones. But if you do transition to barefoot running, you're just going zoop on all of the sliders and everything's somewhere different.
Hmm.
Um, so that is perfectly reasonable to think that that could help. And if you try it and it does help,
Hmm.
God bless.
Yeah.
I'd say more power to you.
Hmm.
Um, we can also say that how can I put this without upsetting my scientific instincts? It's sometimes it can feel nice to be barefoot. Coming home and kicking your shoes off or walking barefoot on grass has a nice feel to it for some
Yeah, I
people
see
in
that.
some
That's a
circumstances.
valid point, I think.
And there's been some fascinating research on how important comfort is on running shoes. So if you feel comfortable and good, if your feet can spread out, if they can move freely, and that feels good to you, I can see a good rationale there for the barefoot
Okay.
running. That's my
Um,
steel man. That's
Very well done. So, Dan, what do you reckon of his steel man? Did he represent your argument well?
Very well. I wouldn't disagree in anything.
Excellent. Right,
It
come
was
on then.
good.
Tell us why we should do trainers not barefoot.
So the difference here is that, like, I've got a lot of patients that they've said, and I've heard all through the years that said, I know exactly when I have to change shoes. Says, oh, how come? Says, if my shoe has done certain miles, what's going to happen is I start to have pain. And that's because the shoes worn off, the cushioning has worn off, and therefore their injury is screaming louder,
Mm.
right? So shoes are important, and I run with shoes, you know. Um,
Hmm.
there's different types of shoes. I run with an ultra with an A, and it's got cushioning, but
Hmm.
it's the same cushioning in the front and in the back of the shoe, and that's called a zero drop. So zero drop of a shoe means that the same cushioning in the back is the same as in the front, because sometimes I don't want to be worried about stones and things like that. If I'm
Mm.
going, like the biggest mistake I've ever done with running was doing an ultra 60K, 4,000 meters elevation with five finger shoes, because it was a trail run and it had all sorts of stones. And
Yeah, can imagine.
at the end of my race, my feet underneath were all bruised and it bruised everything because at certain part, you're just trying to enjoy the run and then your foot just got stoned and
Mm.
therefore it gets bruised. So shoes are important. And like what Rob said, when you pick a shoe, the most important thing is not style, it's
Hmm.
not color, it is comfort. You have to put your foot in and feel like they're slippers, so that your
Mm.
feet can be spread and comfortable. If they all
Hmm.
tucked in together, I mean, Rob could agree, I think, is that biomechanically you're restricting the movement from that toe to be spreading forwards if your toes are all cramped up together.
Mm.
Yeah,
So
makes
So
sense.
just to pause there on that. So some of our guys and girls don't have the money to go out to a proper running shop and get like £120 trainers. They're looking at going to Sports Direct or something like that. So if they were to say, right, I've got to try and fit myself with some shoes, and they're going to get in, should should they be making sure there's like a thumb's width between the top of the shoe? Should the toes, the outer side of the foot, be touching the trainer and bulging out, or how should they feel and what should they look for? Have you got any like tips on that?
yeah, so like what Rob said, everything with a pinch of salt and everybody's different. My
Mm,
recommendation is take the insole off of the shoe, pop it on the floor, put
mhm,
your foot on top. If your foot, when it's going down and you put full weight and it spreads, if it's wider than the insole, let's say
mhm.
your last toe comes off and that shoe is too short for you.
That's a great tip. I love
Length
that.
length in the front, it should be always a thumb of difference. The reason behind it is that when you're going downhill, so your toes don't hit the front of the toe of the shoe, therefore you don't get that black nail. But we discussed this way back in the day, that it's literally because most people don't like to tie their shoes tight at the top because they can do a special loop, the bunny loop on the last hole, and that will
Mm,
stop that foot from falling. We can do a session on that some other day. But
that sounds
yeah,
great. Yeah.
so
Racing is
the thumb in the front, take the insole out so you can feel the proper length. And I agree with not having to be expensive.
Hmm.
Um, you can buy New Balance. New Balance have D width. So shoes that are longer width will be great because every person is have a different width. Some people have it more thin, which then Asics is fantastic. Before me starting doing all this journey, I was a Brooks guy. For me,
Mm.
Brooks, I always felt that Brooks were amazing
Yeah, I'm
because they were
Brooks.
comfortable, light, and I used to use the Ghost, which is a neutral shoe.
Hmm.
Um, but you can also get the New Balance. Now, the reason why I use the Ultra for my running or the five finger shoes is just because they're light. I don't feel that I have shoes on my feet because
Mm,
they're like a couple of grams, like 12 or 14 grams. You don't even feel it. It's just like
mm.
they're light.
No.
And that's it.
Dan.
Oh, cool. Rob, have you got anything to chip in on that?
I've got a question. Dan, are you a forefoot striker, midfoot, or rear foot?
Here's the thing. I tend to do midfoot to front foot
Yeah.
because for me, biomechanically, it's more important to land straight so your arch can go flat, spread, and go forwards. But like everybody, when we walk, everything
Okay.
is heel strike.
I was just curious. That was all. There was something that I picked up a little while ago. I thought that barefoot. I mean, I know, as I say, you're not a barefoot runner. You're a barefoot round the houser.
Yeah.
But I'd always believed that barefoot runners tended to the forefoot strike.
Hmm.
Not true, apparently.
No, no, no. Mostly
72%
because
of
yeah,
72% of barefoot runners heel strike. But yeah, in terms of shoes, I would more or less echo what Dan would say. Certainly a little bit of length at the end. You have got to be careful that you don't have too much space because then you end up flopping around inside, and that
yeah,
can cause problems as well.
yeah.
Mm.
Um, and just going for something that feels right. You just know when you put a trainer on and it feels right.
Yeah.
It's a good running shoe is like pornography. It's hard to define, but you know it when you see it.
Okay.
Um,
Oh
it's
man.
and it more or less, yes, the comfort. I love the New Balance fuel cell for a sort of mid to low cost,
Mm.
Yeah,
better than an Asda, but not a £250 worth of Vaporfly. Then
Yeah.
that's my go-to, and I love Asics because they usually tend to the wide and more cushioned end of the market. And most of the people I'm putting in trainers are not actually runners. They're people
Mm.
where I'm trying to mitigate the same forces that runners have to deal with,
Yeah.
but not actually runners. And yeah, the lacing, absolutely. People will spend £150 on a brilliant pair of trainers, and then you'll see them just hammering their foot into it without undoing the laces before they go out for a run,
Yeah.
which makes you cry.
Perhaps we should do something about that and talk about the laces, maybe at another.
Yeah.
Do the laces.
Yeah,
It's not complex. Just do the damn laces.
yeah. I've got two questions on that then. Okay. So number one is the carbon plate things that they do now, the new trainers that have the carbon inside. Um, just a quick fire question to you, Rob.
Yeah.
Like them, don't like them? Thoughts on them?
Agnostic.
Neither, yeah.
It's an attempt to Dan will know more about this than me, but it's an attempt to improve the energy return. It's building an external spring to complement the internal spring of your foot. And there was the big hoo-ha, wasn't there, about is it technically cheating?
Yeah.
Yeah.
I'll be perfectly honest. I'm profoundly disinterested in something which allows somebody to shave 6 minutes off their marathon time. I'm interested in somebody who is in pain and I can get them out of pain. I love fibromyalgia. I love chronic pain syndromes. I love working with people with CM. I like people who are more knackered and can be.
So you're not really a sports scientist in that respect. Yeah.
Give a crap if they can run an extra knock 6 minutes off their time.
See, that's the difference because
so I don't have a view.
I'm a coach. I love treating and teaching people how to run properly.
So come on then, Dan, educate us. Tell us about these bleeding carbon things. Are they good or bad or what?
I agree with Rob, right?
Yeah.
I agree with Rob. But I care about those 6 minutes. But I care it on a biomechanical way. So when I teach people how to run, as you see me do it lots of times, when I teach people how to enjoy their run, enjoy how they take that hill, how they breathe, how they integrate that synchronization between head to toe, that's what's going to give them that extra 6 minutes, that increases that performance, that when they get to the bottom, they go and look back and they go, oh my God, I've never done it that so quick. So for me, it's more about body performance rather than the shoe performance.
Yeah, stop relying on external factors.
You're almost making me want to start to try running again, but not quite.
You should. If anyone could teach you how to, in all fairness, I am very, very good at teaching people how to run. But if you need some help because you actually have a reason why you have a barrier, a health condition as a barrier, and that's where Dan would be the person who could teach you to run because he has that, that real, and that's the truth. That's the truth.
Rob,
you don't want to
run. Rob, this is how I start my gait analysis with every single person. Why do you run? Most people's answers is, I want to do a 5K or a 10K or marathon. I want to lose weight. And I take that off the plate. I says, from today on, and this happens with everybody, from today on, you will start to enjoy your runs. So your thrill is not at the end of the run that you said you've done your 5K. It is doing the run because you won't struggle because I'll teach you to have fun. And if you have fun during the process of running, when you achieve your goal of doing your 5, 10 or marathon, you will keep on running because you enjoy it and you're now not doing it because of trying to achieve a goal of weight loss or distance.
I made a club out of that principle. I literally made a club out of that principle, Dan. That's exactly it. The run is your treat. It's not that you can have a treat after your run and you can have this, or I run so that I can have something else. No, you're lucky you are able to run because it's a gift. And that's what I always try to tell people. Sorry, Rob, I didn't mean to jump in there.
Are you familiar with the idea of type 1 fun and type 2 fun?
No.
No.
Type 1 fun is stuff you enjoy while you're doing it. Type 2 is the stuff you enjoy in retrospect.
Yes. Yeah, that makes sense.
So if you decide you're going to climb a Welsh mountain and you're soaking wet and cold and your feet hurt and everything, you're happy after it. Yeah. So what you're saying is more type 1 fun and less type 2 fun.
Yeah. It's important. It is important. Okay, I've got a good idea for us to finish on. Okay.
Well, I have a good idea as well. I wanted to give people an exercise.
Oh, go.
So
Well,
we've
hang
got,
on 1 second. Let me tell you what the thing is, so then you can think about it. So while you're, and then we'll listen to your little explanation. So it is I was just going to say, Dan, you go ask Rob, what's a question you've always wanted to ask a podiatrist? And Rob, as a podiatrist, what's a question you've always wanted to ask an osteopath? So I thought you
oh,
could ask one each to each other. And while you're thinking, Dan, show us your tennis balls.
the golf ball,
Oh, it's a golf ball. Is it?
the golf ball. So basically, a, a lot of people disregard our feet, and Rob knows this better than anybody. And a nice exercise that I like to give my patients is I've got a lot of patients that are golfers and they just give me balls. So I store a lot of balls. When I get people that don't play golf, I'll just give them a ball. A really good exercise for the foot, because we're talking about how to get them stronger, how to get them more stable, is removing some of that stress from the running, from the walking, from the stress, is that we don't pay attention to the foundations. In a house, when you build a house, you have to have a good foundation. Our foundation is our feet. So a golf ball on your foot when you're sitting down watching telly, basically just roll your foot backwards and forwards. It will help release the tension that you have built during the day through the running, increases circulation and mobility of the metatarsals and ankle joint, which will improve your walking and you're running.
That is a brilliant tip. Thank you. Rob, anything you want to add to that?
No notes. Absolutely good. Yeah. Any kind of massage or anything that moves things around, that moves tissues around, that moves the
What
fascia
about like a foot
around.
spa? What are your thoughts on the old foot spas that people have? Do they do much, or are they just to feel nice?
If they feel nice, then they're doing something.
Yeah,
Yep.
okay.
If they're not feeling nice, they're not.
Okay, fair enough.
Much the same comment as with Dan's comment about the running. If you're doing it and the foot spa is the treat, it's good. If you're doing it for an end which is not met in while you're doing it, it's not doing
Yeah.
anything.
Fair enough. Okay, go on then, Rob. Do you want to start us? What's your question for Dan? What's something you've wanted to ask an osteo?
Um, Obviously you'll have had a lot of experience with podiatrists of different types and different contexts and different levels. What would you have us understand about osteopathy that we don't understand at the moment?
Oh my God, Rob, that is such a good question. Oh,
He's a smart guy. He's a smart cookie, old Rob.
that is it. So, like when I was telling
I
you about
won't take
the,
anything personally, I promise you that.
okay. So the one thing that us osteopaths do love is about integration with all modalities, with, like we were saying, the five models, thinking outside the box. And I feel that the same way as a physio, if the patient comes in with a shoulder pain, they're only going to look at the shoulder. And you seem, Rob, this is our first meeting. We've never met before. And you seem an outside of the box kind of guy. You're scientific, but you're still looking outside the box, which is the only thing I ask from other professions, because you know about more about feet than I do because it's your profession. But I address the whole body when my patient comes in, and I always start with the feet because I like the biomechanics of the feet, like I just mentioned about the foundations. So it's that I feel that not you, but most people look at foot problems as just being foot problems, and pronation is one of them. And then I feel that they're always trying to sell people this orthotic that costs a bundle of money and it's not going to resolve the problem. They have to use it for the rest of their life. That doesn't make any sense in my head. And they don't address the hip, which is probably one of the biggest causes of the problem, or low back or sacrum because they've fallen. They just address themselves to one thing. And like I teach osteopathy and I teach osteopathy to physios. And I say the best osteopath is the one that was a physio before because they have all the ground exercises and foundations as a physio. And now they're going to bring the out of the box experience into it.
Mm.
My thing that I would like, and I try to do this in my clinic and bring in different professions to the same clinic, which is active care, is trying to get that understanding of we are not just one part of the body, not just the hand, not just the elbow, not just the foot. And if people will work together between different practitioners, midwives, osteopaths, physios. We could all excel if we talk together, and especially GPs, because it would save time with their patients. Because if you don't know something and you have somebody in the room or in the building that that you could just give them a quick question, then what do you think about that? Is that, oh, it could come from here, here, or there. Okay, then this is for you. I'm going to pass to you. And then, okay, I'm going to pass you a couple more patients because I think that's more directed to you. If
Mm.
this wasn't this ego and pressure about people having to fix people all by themselves, that would be great.
Yes,
Love that.
that's a great answer. Really good
Love
answer,
that.
Dan.
No notes. That's perfect. I would agree entirely. I think if I can talk about orthoses without getting lynched by my colleagues, I think when I qualified, so back in the 90s, I understood biomechanics. I knew how all of it worked, and the orthotic was generally the solution. And most of the people who came in with a foot problem, musculoskeletal foot problem, got an insole. And then the more I've learned over the last 25 years, the more I realize I do not understand biomechanics. And indeed, we do not understand biomechanics. And now it's about 1 in 4 of my MSK patients that gets an insole, and fewer than that is custom insoles. So yeah, I think it's a problem that we have, that we want, partly because the patients want it, but we want an extrinsic solution. We want to be able to have a nice, simple solution. There's a complex problem. Here's an insole. Now you're cured. And it's
Yeah.
nonsense, and it doesn't work, and it's never worked that way, and it never will work that way. But a lot of us still do that. So yeah, that's entirely fair.
That's a great answer. I'm very honest. So, Rob, go on, give him some back. What's your question?
So what's the brief again?
Oh,
What do I want osteopaths to know
uh,
about podiatry, was it?
so
Or
no, sorry. Yes, yeah. So what did he ask? He asked, what's it? I asked him, what was
No,
it?
Rob asked me a question.
yeah, no,
Oh,
you've
I'm
got
getting myself
you've got to
mumbled
ask
up.
me,
Sorry.
Dan. You've got to
Dan, sorry. Dan,
you got
you
to
ask
ask me
him.
a
I'm
question.
sorry.
Um, so what do I want to know? So what do I like to know? So I'm intrigued. Do you do surgery?
That's an easy one. We podiatrists are trained for cutaneous surgery, so we only go to the level of the skin.
Okay,
Uh,
so people
Podiatric
that have
surgeons do
uh,
bone surgery.
so I'm thinking about patients who've had a bunion.
Yep,
So where the foot has gone literally across.
yep.
You've talked about that in the previous video. How would you, what would be your ways of treating something like that biomechanically has been changed over the years?
Yeah. Okay. So I would say the first question is, do we need to treat it? Is it a pathology that needs to be treated, or is it just a normal variance for that person?
Hmm.
Because there's a lot of different shapes of feet out there, and some of them work even though they're extraordinary shaped. So as a throat clearing, I would say we should only be treating pathology, not variance.
Mhm.
If something looks weird but it works, it doesn't need treating. As far
But
as
what do you consider pathology? That you consider pathology being, let's say the patient is walking in, has pain, and it's
Yes,
inflamed. Okay,
I would say a pathology is something which is preventing the person from doing the things they want to do.
good. And that's just to clarify for
Yep,
everybody.
100%.
Yeah, so I'm guessing, like you're saying, if they've got a six toe, but it works fine, it doesn't do anything, it's not causing a problem, it's not infected, you don't need surgery to remove
Just
that
means they
six
live on
toe.
the Isle of Sheppey. That's all.
You just live on. Yeah,
Um,
sorry, Steph and
so
the gang.
yeah, but by way of throat clearing that. But otherwise, as far as joint foot surgery is concerned, foot surgery is never the end of the story. It is never the case that somebody has a foot operation and then it goes forward and it is fine thereafter in perpetuity. So to actually go to the level of surgery, which I think was the question you asked me, um, we would be doing a risk assessment in terms of what are the risks and benefits of doing the surgery, what is the likely outcome we're going to be able to get, versus what are the risks and benefits of not doing the surgery, because there are risks to not intervening as well. And only if there is a clear benefit on the surgery side would a good surgeon intervene. Surgeons are a lot like podiatrists and I guess like orthotists from the point of view that there are some who are a little knife happy and operate when they perhaps shouldn't. And there are probably some who are too far the other way and don't operate when perhaps they could. I would say the big toe joint, which is the most common surgery that we do, it can be improved upon if it's particularly troublesome. But there's a life span, there's a life expectancy. It's like when you have a hip done and they say that hip will last you 20 years. So it's the opposite of normal. With most people, we say, oh, they're too old for the surgery. With foot surgery, very often we're saying, no, they're too young.
Yeah,
That's
like
that
knees,
joint,
isn't it?
if we stick a plastic joint in there, it'll last, 15 years of puttering around Sissinghurst Gardens, no trouble at all. It's not going to last an ultra marathon or 5. So I would say generally I am very conservative in terms of surgery. It is a weapon of last resort that we use when nothing else has worked.
Thank you.
Lovely. Well, gentlemen, thank you very
Fun.
much for your time. Shall we do it again?
For sure.
I'd love to.
What are we thinking next subject, or should we put it out? So, if you watch this video and you want to write in the comments an idea of things you'd like us to chat about, we could do a quick fire round or something.
Yeah, question for Dan, question for Robert, question for Steve.
I like the sound of that.
That sounds good.
Also the idea of maybe we could critique some videos. So we put a video up and say, right, what does the osteopath think? What does the podiatrist think? And then what does the lay person think?
Get some marketing videos maybe and pull them apart. That's always fun.
Is that a video about you running? Is that about you running, Steve?
No, you're not allowed to film me running. I've got the worst technique ever because I'm part gorilla. I'm not like a graceful gazelle like you. Some people are built better than born like books, so we have to make the best of it. I can do 10 pull-ups, Dan. Can you do 10 pull-ups?
And I can do 10 pull-ups.
If you ever see me running, start running as well because it means something's chasing me. That's the only contingency.
I know.
All right.
It's really good. I really enjoyed it. Thank you, gentlemen. It's been a pleasure.
Here. Cheerio, everyone.
Thanks, guys. Thanks, Dan.
Thank you.